Neonatal jaundice is a yellowish discoloration of the white part of the eyes and skin in newborns due to elevated levels of bilirubin, which is a yellow substance produced when red blood cells, which carry oxygen around the body, are broken down. It is common during the first weeks of life, especially among preterm newborns. The symptoms of newborn jaundice usually develop 2 days after the birth and tend to get better without treatment by the time the baby is about 2 weeks old. In a small number of cases, jaundice can be the sign of an underlying health condition. This is often the case if jaundice develops shortly after birth within the first 24 hours. Yellowing of the skin can be more difficult to see in newborn or black skin. It might be easier to see on the palms of the hands or the soles of the feet. Today on your regular health TV talk show, The Physicians, we'll be discussing jaundice in newborn. How serious is it? Stay tuned. It's another day with The Physicians, where your health is our business. It's always a thing of joy knowing that you are seated, waiting anxiously to participate and listen to your regular health talk TV show, The Physicians, where your health will always be our business. My name is Dr. Maxina Agberie, the regular anchor on this program. And of course, as usual, I'm not alone. I have with me my very, very intelligent, cerebral co-anchor, Dr.
Emuna Yusuf Kadri, and of course, welcome to your favorite health TV talk show, where your health is our business.
And will always be our business. So we're talking about jaundice in newborn. How serious is it? What does it? I'm sure it rings a bell, right?
It is serious. And before now, when we're talking behind the scene, I was telling you, like, look, you know, as a medical student, health officer, you know, there are some things that you see and then you just like, maybe this is what it is. But now as a psychiatrist, I don't reflect back that, you know, what our senior colleagues were talking about, like, so in some cases I'll be running around. When you need blood transfusion, they'll say, there's really no need. Because even if we do the blood transfusion, we will do it, but we already see that there are going to be complications. And truly, you know, I might have rotated, because I remember a particular case, I rotated to another department, OBGYN. I saw a patient, a mom of a patient we managed months ago, started coming and started saying the baby was not sitting, you know, she had not attained neck control. And, you know, the doctors were like, yeah, we know that these things we have, of course, not the fault of the mom, but kind of like letting us know that there are going to be complications. And it's really, for me, I think this topic is so apt at this point in time.
My own experience was as when I was doing my house job, okay? And we had this baby. We just had neonatal jaundice. And you won't believe what happened. With every prick of the needle, the child was not even feeling anything.
A child?
Yeah.
A baby?
Yeah.
No pain?
No pain at all.
The pain sensors were not...
Everything, no pain. The mother was like, what is happening? This boy child, no matter how many prick, no pain at all. He wasn't feeling anything. Well, anyway, the child did not make it at the end of the day. And I also recall they always used to do this exchange blood transfusion, EBT. Yes. At the stage, one of the mothers said, "Oh yeah, Milenu, you know, I'm tired." And the doctor said, you don't be tired. You have to do this. You understand? So, but awareness is actually very important. Even when I was in my community posting, then they used to bring the babies out in a community where they don't have this management. They bring the babies out in the sun. Then when it was getting hot, they take them in. Those are some other ways that they also use.
The beauty about this that we have a very knowledgeable guest that is going to, you know, like, school our participants and our
I'm actually looking forward.
I can't wait, because I know when you hear people that are knowledgeable in their field and they are spilling it out, we also get
when I had a conversation
at the end of the day.
I had a conversation before bringing her in, I knew that she needed to be on The Physicians. We'll be back after this short break. Just ensure you don't go away. Don't watch this program alone. Call your family members, call your friends, because we're going to be talking about jaundice in newborn. How serious is it? Back after the short break. Stay tuned.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Welcome back. If you have just joined us here on your regular health TV talk show, The Physicians, where your health is our business. Today we'll be discussing jaundice in newborn. How serious is it? With me in the studio is a consultant neonatologist. She is also a senior lecturer with the College of Medicine, University of Lagos, and doing her consultancy as a neonatologist at the Lagos University Teaching Hospital. She is no other person than our very cerebral Dr. Beatrice Ezenwa. Welcome to our program.
Thank you very much.
You're welcome, ma'am.
Thank you very much.
It's a pleasure having you.
Wow, neonatologists taking care of the newborns. What caused that interest? Before I take you to why the interest in babies? Just very cute babies. Why the interest?
I'm a pediatrician first and foremost, and when we train, we go through the neonatal unit also. So during that training, I found out that I have an affinity with the newborns. The newborns are the neonates in the first 1 month of life. Okay, so and I developed interest there, and since then,
very stressless. They're not like adults that will be giving you so much trouble.
But they can cry.
But they can't cry.
You know, that's
they are more stressful than adults.
You know, the pediatrician will say irritable but not consolable. You know, that's the statement.
Okay, so let's go to the business of today. We're talking about jaundice in newborn. How serious is it? In the first, maybe just give us a general overview. What is jaundice? How does it come about?
Okay. Jaundice is the yellow discoloration of the skin and the sclera in the newborn. Okay, and this yellow discoloration comes out because of the breakdown of the blood cells in the body, which comes out as bilirubin. So it's actually the bilirubin that stains the skin yellow and the eyes. So the jaundice will start first from the face. The jaundice, if it's in medical terms, we say that it's cephaloscodal, meaning it starts from the face and go down. So you cannot see jaundice in the feet when it's not already on the face and going down. And it moves. So the way it goes is also determines the severity of the jaundice. But there is a catch there, because when people like us, blacks, you may not be able to really see that jaundice very well, but you will see the one on the eyes. So if, as I said, that it moves, and the more it moves, the higher the severity. So if you are waiting until it gets down to the palms and the soles before you can see it, it means that that is a very severe jaundice for that child. So that brings us the importance of testing. Once it's noticed on the eyes, it has to be tested to see the level, because if it's a white skinned person, you may be able to say, okay, it's just on the face, it hasn't gone down. But for a black person, you may not be able to really say so. Okay, so you have to manage both doing the test for it and also what you can see visually. Okay,
so you already talked about what jaundice is, and in saying that, you nicely talked about bilirubin, okay, which is the cause of the jaundice. Is it only the bilirubin that is responsible
for jaundice?
For jaundice? The main cause, and let's talk about the symptom. The main cause and the symptom.
The bilirubin is actually the cause of the jaundice.
No infections or any other thing?
But the presence of other things worsens it.
Okay.
So a child who has yellow discoloration of the skin, also having infection, okay, or did not cry at birth, and they're having, so the two will make it worse for that child. And what is the problem? Why is jaundice serious? Okay, it's really serious because if it crosses the blood-brain barrier and enters the brain, it stains the brain and it gives it a permanent stain. So when it stains the brain, it disorganizes things in that brain, okay, and it's going to be permanent, and that is what makes it difficult to manage, because that baby whose brain has been stained with that yellow discoloration is going to have problem throughout that person's life, and the degree of staining is also what matters.
Okay. You said something about crying at birth.
Okay, if a
What
child
is the
did not
significance of
cry,
that?
if a child did not cry at birth, it means that that child did not breathe at birth. So we usually say, did the child cry at birth? We ask mothers all the time. Okay, a crying baby is a breathing baby. So if a child is not breathing, if I ask a mother, did your child breathe at birth, they will just be looking at me, because when we breathe, we are not even aware we are breathing. It's an involuntary action we are doing. So, but if a child is crying, even people who are not there will hear. And a lot of people, we know that in our own culture, people will just be outside, and once they hear the cry of the baby, even people outside will be jumping. Okay, so if that baby did not cry, it means the baby did not take their first breath and they are not breathing. So you can cry and then stop breathing. It can also happen, but most of the time they didn't take the first breath, because that first breath comes with crying. Okay, so even years after, if you ask a mother, did your baby cry at birth, they will remember. Okay, so that's why you always hear us, did your baby cry at birth? And for other problems that comes with jaundice, we say, why are we worried about jaundice? Because the jaundice, when a baby has jaundice and it progresses to the extent that it has affected the brain, the baby will come down with what we call cerebral palsy at the end of the day. Okay, depending on the severity of the jaundice. And the jaundice that a baby have, if you get it, if you notice it early, it can be treated. Okay, but when you don't notice it early, or you delay in before you come for treatment for it, or people doesn't know, because a lot of our mothers don't really recognize jaundice in their babies. I have seen mothers that will come and they said the child has yellow discoloration, and the mother believes because the child was fair, that is because of the body. She said that her grandmother was yellow. They are all light in color. So the baby's color is because the baby is light in color. Yeah, because they didn't know. So if it's not recognized in time, and help is not sought in time, it can also cause a problem for the child. And like I said before, there are other things that can also make that jaundice very worse. If the child already has infection in the newborn is a major cause of morbidity in the newborn. If a child did not breathe at birth, if the baby, because there are so many other causes, if the baby and the mother's bloods are not did not match, it can cause the baby's blood to break down. Because we say that bilirubin that causes problem is actually as a result of breaking down of blood cells. And breaking down of blood cells in the newborn is common for everybody. It's expected in the newborn. So they are actually expected to break down their blood cells. Okay, but it's when it's being broken down too much, and the liver is the liver that handles those wastes, so that the body can, it's like a waste product of breakdown of the red blood cells. So if the liver doesn't handle it well also, maybe there is a problem with the liver, they won't be able to handle it. Okay, sometimes when the baby is too immature, the liver of the babies are usually very immature. They don't work as well as an adult liver, and the more immature the baby is, the worse. That's why preterm babies, we have a worse jaundice than the term babies. Okay, so but as they get older, their liver gets stronger and can cope with so many of these. But at that point in time, they are when it cannot cope, you start seeing that jaundice rising in the baby. And the good thing is that it's only in the newborn that jaundice is treatable.
Okay.
If an adult
Has
has
a
jaundice,
jaundice,
I know
there's
you
a
can no
whole lot
longer
of
treat
things
it
that
like
you
you
can
treat
think
that of a newborn.
Wow, it's getting very interesting, but you just need to hold it there because we need to keep a date with the physicians. We want to hear from our audience what they have to say about it, those that have experienced or know somebody who has gone through it before. I'm sure you're keeping a date with us. We need to hear from you. Have you had somebody, a baby, who had joined this? How did it manage it? How did you cope as a family? We'll be back after the short break. Stay tuned.
Yeah, sure. I don't know. I know the person get yellow eyes. That is the jaundice. Maybe some having an accident or some having maybe too much sugar or what did I call it? Forgetting what. But I'm having accident.
Every day and in every way. Enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Welcome back. If you have just joined us, you're on to your regular health TV talk show, The Physicians, where your health is our business. We'll be discussing jaundice in newborn, and really we can see that it's actually a very serious child health condition. And in the studio with me, we have a consultant pediatrician, a neonatologist. She is also a lecturer, senior lecturer with the College of Medicine, University of Lagos, and of course practicing with the Lagos University Teaching Hospital, Dr. Beatrice Ezenwa. Now we talked about some of the challenges, the causes. You told us about cerebral palsy. Cerebral palsy simply means like brain death. So the things that will come with it, the child can't even suck, the child can't cry, the child becomes a bit irritable, then after a while becomes just generally not really active, can't even suck at the breast anymore, can't feed. And sometimes some of the challenges, epilepsy, the child begins to have some seizures. That was what we discussed before we went on break. And now we want to ask her to continue. How is this, how can treatment be achieved? And what is the prognosis? Because you talked at the beginning that when it begins to get to where the jaundice is already getting to the limbs, the extremities, it means it's getting serious. And when the child is like convulsing, having seizures, it means the brain is almost affected. So at what point do you think that a proper management can be done? So how is it managed, that the treatment and the possible complications?
Thank you very much. As I mentioned before, almost nearly 80% of babies may have jaundice, but it's not all jaundice that is really causing problem for the child. It's just in some of them that they progress and then become a problem. And how do we know a jaundice that has become a problem? Okay, jaundice, you notice the first day of life is always a problematic one. Okay, so it has to be treated. Then there are levels that the jaundice should not pass. Okay, so that's why once it's noticed, you have to check, keep on checking, because the higher it goes, the severer it becomes. So a jaundice that has reached a certain level that needs to be treated. If it's a 10 baby, meaning this child was carried up to 9 months before the child is delivered, and the child is not ill, it's just that jaundice. Okay, by the time the level is getting to 12, 15 milligram per dl, it has to be treated. And how do we treat jaundice? There are levels. For those ones that are not yet very severe, you can use phototherapy. This is the light you most of the time you see us shining on the baby. However, there are different types of phototherapy, that people can be shining light on the baby and it won't be doing anything for that baby. What does the phototherapy do? It tries to break down, it converts the bilirubin, that bilirubin that is causing problem, it converts it to a soluble a bilirubin that can now be excreted through the urine. Okay, ordinarily bilirubin are lipid soluble, so if you don't shine light on it, the body will not be able to remove it through the urine. Okay, the body removes jaundice through two ways, either through the stool or through the urine. Okay, so the one that is removed through the urine has to be converted to the water soluble one. Okay, so and that is what the phototherapy does. Okay, because the babies have a large surface area. If you shine light on them, it can break down that bilirubin so they can be excreted. Then they can also pass it through the stool. If the jaundice becomes too much, that even the phototherapy will not be able to do justice enough for it, then we do what we call exchange blood transfusion. What you're doing when you're doing exchange blood transfusion is you are trying to remove the jaundiced blood from the baby and giving the baby another blood that doesn't have jaundice. Okay, so that's, you're exchanging the baby's blood for a newer blood that doesn't have jaundice. And we do this for very serious jaundice levels. So babies who have jaundice that is very high, or babies who have jaundice and have other problems, like they have sepsis, that is infection, or they did not cry at birth, remember, or they have some enzyme problems that is making that jaundice to rise too fast. So you may need to change the blood for them, and we call that exchange blood transfusion.
Now, I think this discussion now will be that, you know, if I want to speak on my on the knowledge I've gained here now, is so that educated woman who knows what it is, but you know, came to the hospital, had a baby with jaundice, maybe just phototherapy, went home, or you know, exchange blood transfusion, you know, and then went home. Now let's bring it down to our communities.
Okay.
This is a woman who had the baby at home, who is a black baby, and this baby is black. What should they do in order to say no, that this is jaundice, and when to come to the hospital? On the other side of it, I also want us, because I remember you telling us that, you know, in the communities where we have noticed this in as far back as 20, 25, 30 years ago, that they used to put the babies under the sun, you know, sun, early morning sun. And you told us, no, it is not early morning sun. So let's bring it down to our communities now, because from having babies at home to putting the babies under early morning sun, what are the real things they should watch out for, and what should they do?
Thank you very much. For anybody that notices jaundice in a newborn, the best thing is to take that baby to the hospital. Okay. Then there are babies that when you take them to the hospital also, do they actually have what it takes there to actually manage the child? Like in the village that you've just mentioned, okay, the safest one is that, did they recognize it? Nowadays, people deliver in the hospital or deliver, and within 6 hours they have gone.
Exactly.
If you remember that this jaundice starts around the second day of life, okay, and by that time many people have gone home. Okay, so it should be part of every woman's. They should always put it in their mind that once they deliver, within the first 5 days to 7 days of life, they must take that baby back to the hospital where the baby was delivered, so that they will check. Like I said, a lot of women cannot recognize jaundice. Okay, so the first thing is to recognize it, and then the second thing is, are we doing the right treatment? And the right treatment for jaundice is to start phototherapy. The sunlight, okay, the sunlight is not really for us here. I cannot encourage people that has jaundice that they as sunlight to be a mode of therapy, because the sunlight, even though it has some capability to bring down the level, but what is also contained in that radiation from sunlight it's more than, it causes more problem for the child than what it does for the child. And the early morning sun that people are talking about is really not early morning sun, because the wavelength in the early morning sun for the phototherapy is not enough. It's actually the very high sunlight. But because of that, it causes more problem, dehydration, it can cause burns for the people, babies. Nobody will advocate it. However, there is what we call filtered sunlight. If that one is available, one can use it. Okay, so but for us here in Nigeria right now, it's not a mode of treatment. Anybody that has jaundice, please, early morning sun is not the treatment for that child.
So you heard it from the consultant herself. You're going to be doing a lot of disservice if you don't take that child to the hospital. Lend a helping hand, even if it's your neighbor's child that you have noticed, the baby. If you go to visit at the hospital and you notice that the child is jaundice, or these days that the mother won't get home 6 hours after delivery, you now notice that the child has jaundice, please tell them to take the child to the hospital, because the earlier the child gets to the baby gets back to the hospital, the better for that baby. No amount of traditional herbs will solve the problem. My name remains Dr. Martina Agbere. Till next time, stay blessed.
Thank you very much, Ma, and it was a pleasure having you to talk about jaundice on this show. And to all our viewers, please always keep a date with us. This is a place where we try as much as possible to reduce disinformation and misinformation when it comes to our health matters. The doctor has said it. Don't be a Google doctor. When there is a problem, go back to the hospital and get that help as much as possible, because jaundice in babies, the complications are not immediate. That child's life may be destroyed for the rest of his or her life just because of your ignorance at the initial phase. Please be kind enough to follow us on all our various social media platforms. Our YouTube page is there. You want to binge on anything health, that is the right place to go. Our website is there, and you want to be here like Dr. Ezenwa, just go to that website, click, and you'll be here as our guest. My name remains Dr. Mimina Yusuf Kadri. Until next time, remain blessed.